So we will move over to a completely different subject. Every one of us fears hacking of his or her computer, but can also our anesthesia machine being hacked. So, and if so, what would be the implications? These questions will be answered by Professor Julian Goldman, who has a keen interest in advanced technology and medical devices. Professor Goldman, I'm looking forward to your presentation.
Thank you very much. And of course, thank you very much for inviting me to this conference. It's been so far an eye-opening day. I've learned a lot, and it's been very stimulating. And so it is now time for something completely different. And I don't know if anyone knows how to pronounce that word on top. I can't pronounce it, by the way. I don't speak binary, but anyway. Can my anesthesia machine be hacked? Question, how many in here are physicians or anesthesiologists? Okay, how many are not? How many engineers? How many software developers? Okay. How many are just in the wrong room? That's me. Okay, just 3 of us. That's fine. Okay. Let's see. So what I'd like to do is introduce a number of ideas and cover kind of some basic ideas in security and cybersecurity without going into too much technical detail. And some of these are really just so that everyone can understand some of the principles, and then we'll talk about clinical implications and some of the challenges that we're all going to face or are facing already. So ransomware, we've all heard of ransomware, and everyone has heard about WannaCry about a year and a half ago, I suppose it was. How many here have had computers that have been affected by WannaCry in their hospitals or other businesses? How many here don't want to admit it? So quite a few institutions were affected by WannaCry, even though, frankly, many hospitals and other businesses forbid speaking about it and communicating it. They're very concerned about damaging the reputation. However, it's much more prevalent than people realize. So WannaCry is a worm. It's a kind of virus that can propagate and spread through its own capabilities that were designed within it, which is why it's called a worm, because it kind of crawls around and does bad things. And WannaCry affects, as you can read it, and again, some of these technical points, if they're not interesting or don't make sense, ignore them. Some of it's just to provide more formal detail for everyone. Computer systems have ports. And a port is a way of providing a number to a possible entry point to send or receive data. And so, for example, when you connect to the internet, data is usually sent over a certain port or received over a certain port. And on Windows-based computers, they've been designed with a certain port that's typically used for data sharing and for printing. And that's called the port SMB, Server Message Block V1. There were subsequent ones, V2. So this is something that's used on Windows to send and receive certain kinds of data. Well, the people that developed WannaCry, using some other tricks up their sleeve, realized that that's a really good way, since that's an open port. If your system is designed to print or share data, let's make sure that the virus or the worm can spread through that very easily accessible means. And so what they did is they exploited that port, and it allows for the WannaCry to spread. And typically, it's caught, it's contagious, because someone, say, reads an email, clicks on a link that they shouldn't, and then that begins the infection, which then could propagate through the system. This is a screenshot that appeared from a MedRad device at the time that WannaCry was beginning to spread. You may remember there was a very kind of busy weekend around the world. It started, I think, on Thursday or Friday in Europe, and then we saw more of it in the US on the weekend. And that's the screen. It says, oops, your files have been encrypted. And go and pay us money in Bitcoin, and we will unlock your screen and unlock your system. And explains how to pay. It gives you, they have to give people directions. How many people here have used Bitcoin? 1, 2, Right. That's why they have to give you directions. Nobody knows how to use it. So it's not very useful if you want to make money with ransomware if no one knows how to pay you. So they give you all these directions. Interestingly, I received a letter, a paper letter to my house about a month ago. And it said, "I'm very sorry to have to tell you that I was doing an internet search and I discovered some very damaging things about you. And I'm sorry, but I discovered it, and I promise I won't tell your wife if you deposit," I forgot how much money, "in Bitcoin." I was like, this is really interesting. And so the first part of the page was about, I don't know, what supposedly they found, and then on the other side, it explained how to make the deposit in Bitcoin. It took an entire back side of the page to give instructions on how to make that Bitcoin deposit. So I showed it to my wife, and I said, next time you go to the post office, take this paper because it's against the federal law to send these things in the postal mail. So she took it to the post office and they didn't care. But again, it's interesting that it's difficult to even pay with Bitcoin. So this is what we saw with WannaCry. And so let's talk a little bit about what ransomware is and what it means. So it's a type of malware, and we use the term malware because it's short for malicious software, and it can encrypt or take control of your system and then demands a ransom for you to access it again. It's typically in Bitcoin because they don't want anyone to know where you're sending the money. And sometimes these things are called crypto viruses, crypto trojans, or crypto worms. Doesn't matter. The thing is this, if you pay, will you get access to your data again? And the answer is, some people get access and others don't. There's no guarantee. So that's the first concern you should have, is that you may have lost the money and you still may not get access. The second one is a little bit more interesting. If there is a worm, if there's a virus on your system and it's encrypting your files, and if you pay the ransomware to decrypt your files, that implies that there's an active communication that's occurring between your encrypted system and then over the internet to their system so that they can decrypt your files somehow. That means that you may have other data that's being stolen. It also is fairly likely that those people or person have been watching your computer system and your network for a long time, maybe months, stealing passwords and finding out all about your systems. So basically the last thing, the nuclear option, is when they trigger and they encrypt your drive, because now you know they're there. So that's when they're changing their approach. They're deciding it's time to let you know that they're on your network and time to make some money. So there could be very serious compromise of your network. So it's actually much worse than it appears. It isn't only a problem of losing data or access to data. It's no one knows just what has happened to your system once you have ransomware. So that's the first bit of bad news. We'll look for more bad news as we go along. So this is some predictions. They're as good as any other predictions, meaning they're kind of meaningless, but people get paid money to make predictions. I don't, but they do, which is really great. So they have these predictions about how much ransomware will cost and what kind of vulnerabilities. It's interesting that there's thinking that we're going to see more targeted attacks against individuals with high net worth. And again, these things might be happening already. There actually are a lot of ransomware attacks, and most of them just aren't known, of course. The FBI probably knows, quite a lot of complaints are made, but that data is kept confidential. So it's a problem, and a lot of hospitals have been affected. So now let's move away from ransomware and talk about some specific medical device issues. And again, we're going to touch on different points, and in the interest of time, we won't delve very deeply. But the first recall of a device due to the cyber risk is pretty well known. It was a St. Jude implantable cardiac pacemaker, and then it became Abbott. And it was a firmware update. There was an FDA recall. The information is on the FDA website. And so what kind of activity, what kind of sinister, nefarious things could be done if you have access to the pacemaker? And the concern was that it may cause rapid battery depletion, or kind of consequential would be inappropriate pacing. But there are no reports of patient harm. So according to the FDA website, there are no reports of patient harm. And in fact, it's very difficult, if not impossible, to find reports of patient harm from cyber hacking. So that's the bit of good news. Of course, who knows if the device failed and caused harm because of cyber hacking? Most people who caused the problem certainly would not want anyone to know for obvious reasons. So it's a bit of a mystery, but it does not seem to be a prevalent issue. So there have been quite a few healthcare data-related breaches. So when you hear about cyber hacking, you hear about this topic, in general, they're not about medical devices in the sense of a standalone medical device like an anesthesia machine or a ventilator. They're typically PCs that are connected to medical device systems. Like in that example with in the NAVAt system, it was the PC that was infected because WannaCry infected the PCs. Now, can these viruses affect medical devices too? Well, it gets very interesting. It's a difficult question to answer, and we'll talk about that. But here are some examples of the cases of healthcare data breaches of 2018. And if you see ransomware, phishing, and employee email account access. So these really are ways of acquiring information and then holding the data ransom or stealing the data. We'll talk a little bit more about that, but there are a lot of cases like this. Now, can these viruses and can these worms affect medical devices? What happens if your bedside physiological monitor is infected, or a central station, or an anesthesia machine? What will happen to the device if it's infected? And we will talk about that later. What will happen? It's a tough question. It's slightly more complex than understanding the mechanism of action of general anesthetics. There are more unknown unknowns, that's why. So, had to connect the dots. So, we all talk about IoT or Internet of Things devices, and again, more statistics. It's unclear how accurate these are, but they say that over 70% of medical device ransomware infections are caused by user practice issues. That means unsafe computing, basically. Doing things you're not supposed to do, risky behavior, clicking on links you shouldn't, browsing websites that you shouldn't from the systems. Imaging systems have been affected greatly. That's been a big issue in hospitals. And interestingly enough, nurse call systems have been infected. Again, it has to do probably with the ease of standardized platforms that catch a virus most easily. So let's talk about a really interesting attack, and that reveals the potential sophistication and also the resource requirements, and it's really a thought-provoking attack, and that's the Stuxnet computer cyber weapon, which has been the subject of all sorts of interesting stories and whatnot. So here what you can see on the screen is a little bit of the summary on the left. Some of it has some kind of very technical information. I put there because I'd like to highlight a couple of key points. The first thing is that the Stuxnet virus was designed to infect a specific piece of equipment, and that's a product from Siemens, which is called a PLC, a programmable logic controller. The PLC connects to a computer, and the PLC also is controlling industrial equipment, in this case, gas centrifuges. And these were the uranium enrichment centrifuges in Iran. And the focused attack was designed to destroy these to the extent possible. Now, how do you destroy a centrifuge? Well, I don't know, I'm not a centrifuge expert, but it seems that what you do, these spin at very high speeds, and they have to be perfectly balanced. And there are ways of causing them to start to disintegrate, start to oscillate, especially if you vary the speeds either too high or too low, or in certain sequences. There are different things that I've read. The details don't matter. The point is that it's a high-speed centrifuge, and anything that you do to alter a perfect cycle of acceleration and deceleration could cause it to destabilize. So what they did is they developed the virus. They found a way to make it look like it was authentic with a certificate, as if it was supposed to be loaded on the computers. And then it also used something called a rootkit. And again, if this is a term that's unfamiliar to most people, it's a useful term to have heard. A rootkit is a kind of software or group of software that's designed to give someone complete and total access to a computer system. So when you rootkit a computer, it means you can have administrative control, and the person who's using it may never know. And it's a very old concept in technology, but now you bundle together kind of a known technology to how to take over a computer, you bundle it with some other things, and then you can produce the cyber weapon. So the Stuxnet virus went out there and just sits on different computers, and it says, gee, is there a Siemens PLC attached to this computer? Oh, there is. Well, that's good. And then it checks for a few other things, and then it has to figure out, well, I guess I'm probably currently on a computer at the facility in Iran, and I'm supposed to start to go to work and be activated. So think about the sophistication of something that can derive the contextual information to know that it's in the right place on the right computer and should start doing its thing. Okay, so here's where it gets even more interesting. What this did is it captured information, it captured traffic going from the PLC to control the centrifuge, and it recorded it. Now, I'm just going to go to the next slide to point out this little story, straight out of a Hollywood movie. Now, we all watch the spy movies when someone clips the magic wires onto the camera, the closed-circuit TV, and they record a loop, right? And then they record the loop, and then they play it back, and then they can go and they open up the bank and they drill the vault and they do all sorts of bad stuff. And the dummy who's there watching the monitor kind of sees that nothing ever changes, right? Every movie, you've seen this a dozen times, maybe 100 times in movies. They did this so that the people you see in the bottom left monitoring the operation of the centrifuge saw normal data when the centrifuges were being destroyed. So it's a very interesting and clever attack, and it has frightening implications for storing and playing back patient data on real-time systems. If a ventilator stops and the data is still being displayed, if the ventilator is producing sounds that makes it sound like the patient is being ventilated, if the waveforms are being played back at a central station when in fact, the patient's whatever, has no more waveforms, or for example, this is not just something from the Hollywood movie. I do recommend that you watch the movie 0 Days. It's a documentary that's just very thought-provoking and well done about the whole Stuxnet thing. So it reveals the power, but also there's another story here. The average person working in their garage can't produce a Stuxnet with that level of sophistication, but they can produce very serious malware. It is possible to do that. And we'll take a look at why it's gotten so easy to do these kind of things. So this is something that just came out at a recent conference, spoofing patient vital signs. So this was not done clinically. It was done in a research setting. They went ahead and they used, I just listed the technical tools here for those who are interested in those things. But the Wireshark is open source, free software you can load on your computer and use to read data that's flowing across a network. They combine some tools, and on the bottom left, I performed these screen captures from the YouTube video that they provided of the attack. And you can see on the bottom left, you can see the EKG from a simulator that's coming through with a heart rate of 80. And then a few seconds later, they show the attack and they show the code as it's sending the commands and modifying the data. And then the central station shows a heart rate of 180. So what they're doing is they're performing that modification of the data in transit. So think about what impact this would have in a hospital if suddenly different monitors are starting to show different data, speeding up and slowing down, overwhelming any nursing staff that's available to look at this. And even of a greater implication, I think, as we in this group think about the future for anesthetic displays, data integration, smart alarms, and closed loop systems, and what kind of havoc these kind of problems could have on those future systems, and the inhibitory effect that could have on innovation as manufacturers become increasingly concerned that it's their responsibility to assure that a system will perform and therefore are less likely to connect it to other systems. So what might you see on a medical device if it's infected? Well, actually, we don't know the answer. If manufacturers have performed these tests on their own, infecting their own equipment, they haven't shared that information outside of their own companies. It isn't publicly known how the devices will behave, but it has become somewhat clear as we, within our healthcare system, started to look at what something like some of these viruses, like WannaCry, would do. It seems that when it comes to older equipment, if you have a modern desktop computer or something like WannaCry is designed to go onto that system and spread. But if it's an old piece of equipment, or if it's a medical device with an embedded software that's a version of Windows but not the full capability, it's unclear what that will do. We understand that it might cause the screen to be modified and not show all the data. It may cause the device to reboot multiple times. We've seen that kind of behavior. Or it might just brick and lock up the machine and make it useless. And it may not spread across your network. Now, how would you catch a virus in the hospital? Well, we talked about clicking on an email and things like that, but let's say there's a visitor, and the visitor wants to connect their computer, and there's no Wi-Fi, so they see a network jack in the wall that isn't being used, and they plug into it, and maybe that's part of your physiological monitoring network. That's not a bad way to catch a virus. That's something to be considered. And the current technology in general for networks, for medical devices, don't block the connection of a person's laptop computer. I think that's what we'll start to see in the next generation for medical networks, so that if someone does that, it would not allow it to join the network and would not allow it to spread a virus. But in general, that's still a problem. So the other thing that is worth thinking about when it comes to this topic is, just like with clinical diagnosis, it requires a high index of suspicion. So we've all had medical devices that acted in a weird way, that failed, that weren't quite right, and so we call and we get a replacement device. And also, as part of safety, we plan a backup. The backup might be a self-inflating bag and other things that we can do in case our equipment fails. The thing is, if it's a virus that's affecting all of the ventilators or all of the infusion pumps, you take a new one from the closet and you connect it up to the network and start to use it, and now that becomes infected. Well, that's a little different than the way we're used to thinking about problems like this. We're not used to an entire type of a device being infected. So it isn't clear what to do, right? I mean, we don't know today yet what to do, but common sense says try a different type of device, not just another one of the same, which is in conflict with everyone's attempt to standardize everything. So it's something to consider. And the other, of course, as anesthesiologists, we're all about backup systems, your first and second backup. So going back to various manual things or having backups, remains important. Even as the reliability of our medical equipment has continued to increase, now we might be seeing susceptibility to things that weren't considered back when a lot of this equipment was designed. So high index of suspicion is applicable to this as well as other clinical things. Okay, so let's say you have a high index of suspicion because you're looking for abnormal medical device behavior. What is abnormal behavior? I guess it seems like an obvious question. So here's some data that our team has published over the years to show normal behavior. On the left, you're looking at your electronic medical record, you're looking at the heart rate in the green dots, and you see the minimum rate is 45 in the record, but there's a picture of my pager when I was paged to the OR, and it says that the heart rate was 30. And that's why a resident was calling me in. So the actual heart rate was 30, but the data in the EMR never goes below 30 because of there's an average, and not every data point is there. The point is that our best equipment today still doesn't fully represent patient data. So how would we know if there's a virus that's starting to intentionally drop data points from our record, given that we don't have a complete record today? The second example shows in the center, let me see if I can point. Here you see SpO2 low 84%, and that event occurred at a specific time at 2:07, and then of course it was at 100% there. And if you look in the EMR, there are the blue ticks. There's no drop in pulse ox. value. Saturation didn't drop. Why? Same issue. It has to do with the averaging and the way that the record samples the data and represents it. So how would we know if intermittent values disappear, through the magical effect of a virus, when in fact our records today are incomplete and we don't store the waveform data, we don't store the source data, so we already have these gaps. Another example, we've all seen this many times, here's a low saturation value, and of course it's caused by blood pressure cuff interfering with the pulse ox. So we have the benefit, if we're standing next to the patient and we're staring at the monitor and we have the context, we can determine whether data is correct or not. But just think about the more complex our systems get and the more we're looking to automate, have closed loop control, have better data integration, the harder it will be for us to determine what data is missing or how it's been altered by malware. Again, very examples we've all seen many, many times. Blood pressure cuff on the same arm as an A-line, so you have abnormal blood pressure values. Well, how do we discern whether this is real or this is being caused by interference with devices or by malware? And then, of course, there's the problem with devices that have the wrong clock times. And we performed a study in 5 hospitals of 2,000 medical devices and found that about 5% of devices have the correct clock time. 5%. Not so good. And what's the relevance of clock time? Well, part of security is understanding when data was time stamped to determine whether someone is inserting bad data into a data stream. So if we can't even be sure of what time the data was obtained, we have a fundamental problem with reliability of our data. And this is an example of things that all of you have probably seen. You can see that this clock says 12:06 and these say 12:10, and the timestamp in the record is the one from the wrong clock on the blood gas machine of 12:06. In the study that we performed we found, as I said, 5% of devices had the right clock time. Some of them had errors of seconds, of minutes, hours. What do you think the largest error was? Days? Years? Yes. And if you bundle years together, you get decades. So 42 years was the largest error. Not so good. So we have an ecosystem that's not inherently that reliable. So this is an interesting publication, Cybersecurity for Hospitals and Healthcare Facilities, and it speculates on a number of things, and I thought it would be useful to see, for example, some of the thoughts about anesthesia machine, cyber physical attacks. And the first one is spoofing an oxygen failure alarm, disabling things, changing display information, and so forth. And these are theoretical, right? It's not really likely that most of these things can be done with most equipment. It doesn't mean it's impossible, but of course that now has to become part of the manufacturer's hazard analysis, is the likelihood of these things happening. And when it comes to security and it comes to things like that, we can't ensure that everything is perfectly secure, so we have to start to think of better ways to let us assess the performance of equipment and see if it's not working correctly. But here's a nice little list of theoretical issues, and some of these we touched on in terms of interfering with the monitoring. But you can see from reading this list and drawing the conclusions, there's a lot of rich opportunity if someone really wants to spend the time and undermine anesthesia machine data integrity or performance. And I want to touch on this again, but with some different figures in a few minutes. They also, in the book, go through robotic surgical machines and similar ideas, turning off a video feed, causing things to reboot. So not all of the attacks have to be very subtle and sophisticated. If you can find a way to make a robot reboot a few times, kind of ruins the surgeon's day, it ruins our day, it ruins the patient's day. It's just a bad day. Infusion pumps, nice list of things. Again, the same general theme applies to all the devices. You're either interrupting data or you're modifying data. You're causing a unpredictable communication, and that could apply to alarms, to patient data, or to machine data. Now, and here on interoperable systems, as we start to expand the role of distributed systems, for example, on the more sophisticated closed-loop anesthetic technology that we're starting to see, it becomes even more complex because now perhaps we have equipment that isn't owned just by one manufacturer, now depending upon communication to other manufacturers' equipment. So let's say you want to do some of these things because you're bored, you're semi-retired, you want to cause havoc, or you just want to make extra money with ransomware. So if that's what's motivating you, you can go to Amazon.com and you can buy sniffing passwords using Wireshark, the basics of hacking and penetration testing. Penetration testing is a term of probing the equipment to identify vulnerabilities and then cause problems with the equipment. So this is just an example. Now, that's right, stop him. And so let's say you don't like Amazon and you can't afford these expensive books. So you can just go online and get all sorts of toolkits. And here's a nifty thing you can get. It's called Key Sweeper. It's an Arduino-based device. Arduino is a little tiny computer for about $30. Right? They have computers like this these days, different kinds. It's camouflaged as a USB wall charger. You plug it in the room, and then it wirelessly and passively sniffs all of the Microsoft wireless keyboard. Anything you type in, this thing records and sends it back over over a cell phone link. So very handy if you're a spy. And you can see the problems that these technologies can cause. So there's another important principle here. So some people think my network is closed and secure because I don't let anyone plug anything in to my device or my network. Well, you just plug this into the wall across the room and you now have obtained all the passwords. Now, do you think networks are never touched by other devices? How about when someone from the biomed department rolls in a laptop computer and updates your machine, plugs into the anesthesia machine or the ventilator, plugs into other things and performs a software update. So the vulnerability there is the biomed computer that's carrying the virus potentially. So the idea that my device is safe because it's not on a network and it's never open and it's not a network device at all is simply untrue. Right? It's not really a thoughtful consideration of how devices are connected to each other. So anyway, we're selling these in the back of the room afterwards. But it's for a good purpose. Good purpose. So $35, a good purpose. So here you can just buy an ethical hacking kit. You get 300 tools for PC, for other platforms, and there's the Kali toolkit. And you can buy all this stuff and go to work. The point here is, unlike the early days and the complexity that existed and the incredible effort required to be a brilliant hacker and to understand how to cause all these issues, you no longer need to do that. Right? It's been greatly simplified because the toolkits are now available. And that's really a huge change and part of the problem. So this is examples of, again, this is kind of more technical information for those who are interested. I really found it interesting that the third one on the list there is called Yersinia. That was the applicability to a medical discussion here today. I don't know why they did that. But anyway, this is really more for those who have a technical bent. So now I want to shift gears. So we've talked about the ease with which this is becoming possible, some of the different attacks. I can talk about some of the things that are being done and some of the kind of the larger system considerations for managing this. A very important organization and things that you could easily read about and keep track of and sign up for are things that come out of ICS CERT, Industrial Control Systems Cyber Emergency Response Team. They're at the Department of Homeland Security, and then because of the Cybersecurity Act of 2015 in the US, it has enabled the sharing of information related to cyber attacks. So there are several listservs and things you can join, and you'll get an alert every now and then, and some of them could be quite relevant to you, to your life, to your things that are at home, for your automated equipment. If you have things like a Nest thermostat or other automated Internet of Things devices, or of course things that are in the hospital. So ICS CERT is something you should know about. They issue alerts and advisories and white papers, and I recommend that you become familiar with this because it isn't going away. Now, this is an example of the advisories that have come out on medical devices from ICS CERT. Most of the advisories, of course, are non-medical, but quite a few of them are. And it's easy for you to look at these things and learn and identify if you see a device that you have in the OR or in the ICU or in the hospital, it's quite possible that you'd be the first one who noticed that it's on the list. Depending upon the kind of hospital you work in, you may have an active IT security team, biomed security team, or you may not. So, all of us should have some level of understanding and an awareness. Someone should be looking for these things. So I'd like to now kind of broaden out. Now we move away from some of the technical stuff, and I'd like to talk a little bit about achieving safety versus achieving security. And how many here are work with our medical device manufacturers or work closely with? So good. So those of you who do this are experts in, for example, achieving safety with medical equipment. It's a complicated topic. It requires typically a lot of training and a deep understanding of how you build medical devices and how you assure that they're built safely and then used safely. So I've distilled it down into the version for dummies, okay? So don't complain to me that this is wrong or too simple. This is like the only level that I understand it. That's the level on the left. So the standard that everyone thinks about is ISO 14971. And what happens is that if you look at a medical device and you're building it, you have to think about what could go wrong. Is someone going to be confused because on one device the knob turns from counterclockwise to increase a level output, and on another device it turns clockwise? Well, in order to avoid that, we have standards, for example, for the anesthesia workstation that tell you which way the knob should turn, or other things are not controlled by standards, so the manufacturer has to do their best. So they identify hazards and they modify the design, and then they give you instructions that say, hey, use it correctly. So a really simple thing would be keep this equipment dry so you don't have a shock hazard. And if we see that, and if we see a big sticker on the device that says keep this dry, typically we would not take it and pour saline on the device, right? Because we don't usually do things like that. And we may try to clean it with a little bit of some moisture, but we don't pour a bucket of water on it. So clinicians, biomed engineers, and everyone else that works with equipment, we try to follow the directions because we're not trying to hurt anyone. We don't want to cause a shock or an injury. So the assumption of safety, and you could use other examples. You can talk about a safety culture, for example. The whole essence of safety is that everyone is doing their very best. Their intent is to deliver safe care. That's what everything is designed for in medicine, right? You have a choice of picking up the drug that the patient is allergic to. The option is there. The reason you don't do it is because you're trying not to hurt the patient. That's what safety is about. Okay. It's fundamentally different when it comes to security. That's the big difference. Security on the right side is about people trying to do bad things. So if they can pick up the wrong drug and can cause an allergic reaction, that is what they're trying to do. It breaks everything we've ever done in healthcare, because everything we've ever done is to build the systems, the technology, and the processes to allow good people to do their best, not to prevent the worst people from causing harm. That's why it's such a hard problem. Everything we've built has been for the other purpose. Once you look at cybersecurity and security in general through that lens, you realize why it's so fundamentally difficult for us to switch. Everything has to change. In this case, you can think of many examples. That is what I would propose to you to help you start to think about what is fundamentally different and why it's such a challenge for us. And it isn't really fair to blame older technologies and systems and say that they're not secure. It wasn't. We just thought people would always do the right thing. And that's a big change. Okay, so when we look at connecting systems, how do we think about interoperability and cybersecurity? So a number of manufacturers and other folks are saying, we don't want anyone connecting anything to our device because we don't want to catch a virus. And so they're starting to lock down individual systems, or individual devices. That is really mistaken thinking for a few reasons. The first reason, I think, is self-evident. When you have a computer system, how do you manage the security on the computer? You plug it in to your network, and in many businesses, the network scans your computer to determine that you have the latest patches, the latest antivirus, and you have a safe, reliable system. If you can't connect it, to an antivirus update, if you can't do anything like that, you actually end up with a less secure system over time. Because you still will catch a virus one day when someone plugs in a USB drive with a virus or connects it to something. It will happen one day. But now you have a system that's unpatched, unprepared. Also, all manufacturers monitor their IT networks. Every hospital does it, everyone does it. They're looking for abnormal behavior and abnormal traffic on the network. Most of our medical equipment doesn't sit on the network in a way that lets it be monitored. So all of the expensive tools that businesses use to find malware and to look for abnormal traffic can't be applied to our medical systems. And so, because they're isolated. So for the most part, our medical devices, we don't benefit from the expensive tools that our businesses, our hospitals are using, and they can't easily be managed. That's the older generation, and I hope we see changes. So I think the change we have to see is to recognize that we want intrusion detection systems that we all already buying, licensing, and using to be able to monitor our medical device systems that are on the network as well. So interoperability, just as we have with standardized computer systems, is an enabler of better security. It doesn't undermine security. I think it's a specious argument that some people have proposed, but it really is not well thought out. So as I wrap up, I'd like to talk a little bit about some projects that are underway. And one of them is a follow-on to the WannaCry attack. And the FDA had reached out to an organization called MITRE Corporation, which many of you may know, a very large organization that does government contracting, and contracted with our group at Mass General on a project to start to bring together hospitals and talk about cybersecurity and identify what the issues are, and in particular, what was the response to WannaCry? What are the barriers that we had? What challenges did we have, either with obtaining information, sharing information with medical device manufacturers, whatever it might be? So that is underway, and that project just started in December. And also, the FDA has been curious about whether the community can benefit from a sandbox, from a test lab with shared medical devices and shared relationships, so that when the next bad attack happens, there's a go-to environment where we could all work together. Every manufacturer still has to do everything they do internally and privately, but once you start to mix and match equipment, it requires some way to work together with all the various vendors. And so that's part of the purpose of this project that we've undertaken. We've been funded to do this work and reporting our results publicly. So that's one project that's been underway. Another project that's been underway is a funded project from the Department of Homeland Security, in which we're generating medical device data sets to share with the research community, because as you all know, it's very hard to get medical device data sets from a hospital when there's patient data. So that's another one. This is a letter from Dr. Jeff Shuren, the director at CDRH at the FDA, in support and talking about the need to have a collaboration like this. And for those of you who can't read that, this is the enlarged view of part of the letter. And so we've been working on forming a collaborative of interested parties in medical device cybersecurity. And if this is of interest to you, please let me know when we talk later over cocktails at lunch. This is just a little snapshot to provide background on our lab. We've started working on medical device interoperability back a while ago in 2004, and have been funded by mostly federal agencies, NIH, DOD, NSF, and so forth. And so for those of you who are in town, I welcome you to come by and see our lab. And if you can't make it, it's too far, here are some pictures for you. So now you can say you've seen it. The other thing we're trying to do is find a better way for people to give input and ideas. And so under another project, we developed something called the Clinical Scenario Repository to capture good ideas for patient safety, and piloted this with ASA Committee on Patient Safety. And we took this web-based approach and used it to submit cybersecurity examples. So this is not a real event, it's a theoretical event, but it's an event around infusion pumps and how one might capture a clinical scenario of a cybersecurity breach on infusion pump configuration. And so I just, not going into detail here, but just to show you that this is part of what we need to collect the community's ideas so that manufacturers could be aware of the threats. So is it time to go back to the good old days? Is it time to throw away the computers? and go back to writing on our scrubs. You know, the greatest risk here, of course, was that the person last week wrote with a Sharpie that didn't wash out. I think that the problem with that is that it really doesn't put us in a position to benefit from the next generation of closed-loop control, automation, and advanced technology that we all know is needed to improve the safety of delivery, not only of anesthesia, but across the healthcare landscape. So with that, I'm going to just make an announcement to everyone. Relates to the work not on cybersecurity specifically, but on automation and closed-loop control and autonomous systems. So this new work that we're embarking on at the request of the U.S. federal government to start to bring together interested parties that are really want to work on or are working on autonomous and closed-loop systems, especially related to anesthesia and intensive care or resuscitation. So things that can maintain blood pressure, oxygenation and ventilation, thermal status, hydration, and so forth, and do that in environments where someone may have to be, kept stable for days at a time without more sophisticated medical attention. Maybe for evacuation, maybe a natural disaster, maybe a casualty in battle. So it would include things like a virtual component with remote care, and more effective closed-loop control and automation, which we're seeing, of course, in anesthesia quite a bit. So if this is a topic of interest, if you're doing work already in this area, either in a company or as researchers, let's talk about that later during the break. Let me know so that we can start to bring groups together, maybe at a future meeting or the like. So thank you very much.